This is the Korean kinetic acupuncture procedure for using the calf muscle, gastrocnemics shortening. So for the calf muscle, there can be many conditions that develop on the back of the foot and the back of the heel and the bottom of the foot. So if you look in the picture, you'll see that Achilles tendonitis can develop at the back of the heel. There can be plantar fasciitis is very common diagnosis that every acupuncturist will come across. And plantar fasciitis can affect the points underneath the heel. There can be bone spur development underneath on the bottom of the foot, which can be a development of calf muscle shortening. There can be Morton's neuroma, which is under the balls of the feet, balls of the toes, which is a bean-like nodule that can develop from the friction generated by tissues, stretched tendons rubbing against adjacent tissue. They can be fatty nodule developments, um, uh, calcium deposits, and then, of course, there can be the toe and foot pain of arthritic developments that can generate from both calf muscle and also anterior tibialis. So, following is an excerpt from my book, Dr. Evan Mahoney's Fountain of Youth Stretching, Calf Muscle Stretch for Plantar Fasciitis, Achilles Tendonitis, Morton's Neuroma. The calf muscle stretch is a great stretch for the feet, especially for pain relief from plantar fasciitis, Morton's Neuroma, and Achilles Tendonitis. Even though these pain conditions are located on the bottom of the foot or at the heel, the true root and core of the problem lies in the calf muscle. Due to postural imbalance, wearing high heels, and not stretching, the calf muscles will develop knots which shorten and contract the muscles. Because the muscles are shortened, there is added tension upon the Achilles tendon, which attaches to the underlying tendons and carriage of the foot. The increase of tension upon the tendons causes rubbing and friction against adjacent tissues, which leads to tendonitis, calcification deposits, and neuromas. Because of the uneven tension of the muscles and tendons, the alignment of the joints is likely to be pulled out of balance. We stretch the muscle to relax the tension upon the tendons. And then here is the Fountain of Youth calf muscle stretch technique. So we're going to start by showing you this stretch because this is the position where we perform Korean kinetic acupuncture. And this is going to be the second of the Korean kinetic acupuncture procedures for the calf muscle. So what we do is the calf muscle stretch I perform is a variation off of the common calf muscle stretch. In doing this stretch, bring the foot back as far as possible so that the heel of the foot is still touching the ground. So bring the foot back as far as possible. The heel has to touch the ground. Next, push against the wall with your hands. As you push against the wall with the hands, this will help drive the heel into the ground. So let the force pass through your body. As you push against the wall, let the force pass through the body to the feet, which drives the heel into the ground, which will provide a greater degree of stretch for the calf. Hold the stretch for 20 seconds, take a break, and then repeat. And I generally recommend my patients to do this stretch 2 to 3 stretches per set, and they can do this several times a day. If there is any pain or discomfort doing this stretch, then pull off and take a break. So place the foot back as far as possible so the heel is touching the ground. Push against the wall with the hands. This will drive downward force of the heel into the ground, further accentuating the calf muscle stretch. Now here is the clinical picture that we're dealing with, the Korean kinetic acupuncture calf muscle stretch, the procedure. There are two components to the Korean kinetic acupuncture procedure for releasing muscle trigger points along the calf and stretching the muscle. Procedure 1 is an isometric resistance exercise, and procedure 2 is a repeat of the stretch shown and described just before and above. So the calf muscle procedure. Start with the patient standing in the calf muscle stretch position. The patient's foot is placed as far back as possible so the heel is still touching the ground. The practitioner will be sitting on the ground near the patient's foot and heel. Find the trigger point, knotted areas on the calf muscle. In most cases, the muscle trigger points will be located on the medial gastrocnemics, which is the points pictured in pink above. Most of the trigger points are on the inside of the calf muscle, the medial side. Massage in a distal to proximal direction from heel to knee, from back of the heel to back of the knee, with the three middle fingers firmly pressed against the patient's medial calf muscle. Insert the needles into the trigger point areas of the medial gastrocnemics. Now, it's not just, there can be middle gastrocnemics or lateral gastrocnemics that you may have to do. So you can do superficial insertion 0.1 to 0.3 chun. Test the patient comfort level with the needles by asking them to stand up and down on their toes, lifting the heel off of the ground, keeping the toes on the ground. This is a foot and ankle plantar flexion exercise. The gastrocnemics contracts to lift the heel off the ground. That's going to be important because this is going to be the resistance exercise we'll do in a moment. Adjust the needles outward if there's any discomfort. Watch for the dimples surrounding the needle insertion areas during movement. Dimple areas may indicate discomfort. Adjust the needle outward. So once the patient comfort with the needles has been assured with a test movement of the foot, um, so you make sure their comfort level. Now there is a caution here. Make sure the patient does not feel dizzy, lightheaded, or faint during the massage palpitation and the needle insertion phase. Oftentimes the patient is unaware of the painful trigger point areas on the calf muscle. Even palpation alone can sometimes cause them to feel dizzy or faint. At all times during this procedure, communicate and assure them of their comfort level. Prepare yourself in case they should fall. So, yes, this calf muscle trigger points can be very sore and tender, and the patient will have no idea because that's the nature of trigger points. They can be there. We don't know they're there. We're asymptomatic in some cases, but you press on it and it's very painful. It can make the painful patient dizzy or feel faint. So, in one sense, it is assuring to have pain on palpation of the muscle trigger points. If there is the presence of knots and tenderness upon palpation, the practitioner will be much more assured of their diagnosis and prognosis. The diagnosis is the knots at the calf muscle are the root of the problem, not at the painful area of the foot. The prognosis is favorable with the Korean kinetic acupuncture technique. This is so true, and it's not just for foot. I'm always kind of reassured when we do a wrist stretch and the patient says, "Oh, these muscles are very tight." Um, well, that's reassuring because that indicates that that is the problem area, and it's a tight muscle, and we just need to stretch it out. We need to do Korean kinetic acupuncture, and when the muscles are tight, I expect a very favorable response with the acupuncture and the stretching techniques that we do. So it is reassuring, and you can kind of reassure the patient. You can, when you get more confidence, you can say, I believe this is the problem. And then you'll have the confidence and the assurance to then give them the prognosis that you can get them better today. And this goes back to the Choi progression analysis chart. When there's tight muscles, this becomes a kind of a favorable response. Now there's barring any other kind of complicated conditions going on. But tight muscles generally, and with the absence of something complicated or chronic, surgical, so forth, um, generally is a favorable prognosis. Okay, so the needles are in place and the patient's foot is drawn back as far as possible with the needles in place and the heel touching the ground. Now we are ready to begin the isometric resistance stretch. So we're going to do two procedures. The first one, procedure one, is resistance against the foot and ankle plantar flexion exercise. With the needles in place, the patient is in the fully stretched calf muscle stretch position, heel touching the ground. The practitioner instructs the patient to lift their heel off the ground against the resistance of the practitioner. Practitioner's hand is gripped at the posterior ankle and heel. As the patient lifts their foot off the ground, their heel off the ground, the practitioner can actively push down against this motion as they're gripping at the ankle. Now, another caution here, sometimes the grip, not the needles, can cause the patient pain. If so, you'll have to modify the grip with less resistance. So, yes, with Achilles tendonitis, this can be kind of a touchy thing because that's where the pain is where you're gripping. So you may have to do just less of a resistance, and then you can do the fountain of youth pull on the muscle stretch, which we'll show you in just a moment. So we're doing these isometric stretches. The patient's heels on the ground, and we've tested their comfort level. So you grip the back of the ankle and you instruct them to lift their heel up off the ground as you push down. You're actively like pushing down against the their resistance. So, to the practitioner's count of 4, the patient will lift their heel off the ground against the resistance of the practitioner. At 4, the patient is instructed to relax. So then the patient returns their foot and heel to the floor. And then this exercise is repeated 5 to 10 times. Remove the needles immediately upon the last isometric stretch resistance. The practitioner, this is a little side note, the practitioner will get a sense of the physical strength required to perform certain kinetic procedures like this. So yes, maybe it's the leverage, but this particular exercise requires almost the most physical strength. Now, for me, I'm really pushing down. The patient's lifting their heel up, and I'm trying to forcefully push it down against their resistance. So this one takes some great strength. You may have to get some leverage on it with a by standing atop, like you'll see with the fountain stretch that we're going to do later. Okay, so that's procedure 1. It's an isometric stretch, and then we go into procedure 2. After procedure 1 has been performed, the practitioner instructs the patient to move their heel back. The needles are still in place on the gastrocnemics, but even further. So we're going to instruct the patient to bring their heel back and foot back as far as possible so that the heel is touching the ground. As far back as the foot will go and the heel still touches the ground. The patient will then be instructed to perform the stretch technique described above, which is to push against the wall and let the force pass through the body. So, with their arms against the wall, the patient will push into the wall. This force will pass through the body and drive the heel into the ground, further stretching the calf muscle. The patient will hold for 20 seconds as the practitioner counts off. The practitioner may also want to accentuate this stretch by gripping at the ankle and pushing into the ground. Okay, and then after this, we can repeat procedure number 1 again. So we can do the isometric resistance one more time with the foot still in the same place as far back as possible, heel touching the ground. Repeat procedures 1 and then procedure number 2 again. Okay, and there's a variation of procedure 2 specific for Morton's neuroma. Morton's neuroma is a painful condition usually affecting the bottom of the third or fourth toe at the ball of the feet. A nodule may be present that feels to the patient like they are standing on a pebble. According to the second principle of muscle trigger points mentioned in the opening chapter of this book, friction occurs as stretched tendons rub against adjacent tissue. This can lead to calcification and the development of nodules. Morton's neuroma can be a latter development of shortened calf muscle, which adds tension upon the Achilles tendon, which adds tension to the tendons on the undercarriage of the foot. So, variation of procedure 2 is as follows. As the patient is pushing against the wall in the calf muscle stretch position, heel touching the ground, so we're not doing number 1 with the heel lifting off. This is just the push against the wall, let the force drive the heel on the ground. The practitioner reaches under the toes and lifts them up, extending the toes. The toes can be extended to the practitioner's count of 4 and then relax again. You can repeat this exercise during the duration of the 20-second stretch that the patient is in. Now, I also do kinetic acupuncture with this sometimes. With Morton's neuroma, which is this nodule at the bottom of the toes, I will do a variation of this stretch. I'll put the patient's foot on my lap. So I'm sitting in a chair. I bring their leg up on my lap and I put the needles, I will insert the needles into the nodule area. And then I will lift the toes, extend the toes back, and then they flex the toes against the resistance of my extending of their toes. So you can do kinetic acupuncture for Mertens neuroma by having them sit in a chair, put the leg up on the lap, you put the calf muscle in a stretch, you insert the needles, you extend the toes, insert the needles at the Morton's neuroma, extend the toes, and then have the patient flex the toes against your own resistance. So I will do this for Morton's neuroma. Now here's the picture of what we can do on procedure number 2. These are the examples of lifting the toes up during the calf muscle stretch as part of variation procedure number 2. Lift, count to 4, then relax. And again, I do this same thing, but the patient's sitting in a chair. I put the foot on my lap. I've inserted the needles underneath the toes, and then I extend the toes, and I have the patient flex their toes against my resistance. Here is the treatment plan triangle for pain conditions affecting the heel, plantar aspects of the foot. So Korean kinetic acupuncture is at the base here. It's the first procedure we do, calf muscle stretch procedure number 1 and number 2. Now this also implies that we do the fountain of youth stretching, which is also pulling on the muscle while the muscle's in a stretch, which we're going to be doing some video demonstrations. I have uh, 3 videos I'm going to show you of this calf muscle stretching technique. So we're going to show you 3. 2 are doing the the technique, and then 1 is doing the fountain of youth pull on the muscle while the muscle is in a stretch.
Hello, this is Dr. Evan Mahoney. Today is an advanced acupuncture technique. It's using kinetic acupuncture, and it's for the treatment of plantar fasciitis. Kinetic acupuncture, I learned this technique from Dr. Choi, the chief practitioner of Hamso Children's Hospital in Los Angeles. This is for the treatment of plantar fasciitis with kinetic acupuncture. First, as most any procedure on plantar fasciitis will involve some form of stretching exercise of the gastrocnemics and the soleus. There's hundreds of stretching videos online. Now we are going to incorporate one of those stretching techniques with acupuncture, and that's what defines kinetic acupuncture. Kinetic acupuncture is movement of joint or limb while the needles are inserted. Now today's demonstration, I'm not going to be actually inserting needles. This is just a simulated demonstration of the technique. Plantar fasciitis is defined as pain on the bottom of the foot or pain along the heel, or Achilles tendonitis. So as part of the kinetic acupuncture technique, which may be technique number 1 that you use, you're not going to be needling down here. Later you can go and do a local needle. But for the kinetic acupuncture, the work is going to be done here on the calf muscle. Now, before we begin, we have to explain why. Why do you get plantar fasciitis, pain at the bottom of the foot or pain at the heel? The answer is in trigger points. Trigger points. Trigger points are the clusters or the knots within a muscle tissue. If you ever get a massage and you have a knot, they say you have a knot, that is a trigger point in the muscle. And as a demonstration, if you have a piece of rope and you tie a knot in the rope, it shortens the length of the rope. So if you get a knot in the muscle, it shortens the length of the muscle. This muscle becomes short, the tension on the Achilles tendon becomes more stretched, there's more friction involved, the tendons underneath the foot also are pulled. There can be inflammation or calcification where these tendons stress against another tissue. So the treatment for kinetic acupuncture strictly involves on the calf muscle. Now, when the patient comes to your office, how do you examine them, and how do you make the diagnosis that the problem is here? It's a very simple demonstration. We're going to ask the patient to put their muscle in a stretch, and the knots, to find the knots and the trigger points, we're going to rub our finger upward against the movement, against the muscle, while the muscle's in a stretch. So at this point, I would take some Samra cream or gel, whatever kind of oil, and I ask the patient to stretch their muscle, okay? So this is a calf muscle stretch. Now you take the oil and you rub it up the muscle. How do you know if this is the problem? This will be painful to the patient. By just pressing your finger, the patient will have pain. Number two, you will feel the knots in the muscle. You'll feel the knots on the medial side of the calf muscle. The knots can occur anywhere from the lower to the upper gastrocnemics, but it's typically on the inside muscle. So at this point, by running the finger, the patient has pain, and you feel the knots. You can be certain that the problem is here. The muscle became shorter because the knots is a tangle and cluster of muscle tissue that shortens. The Achilles tendon stretched and all the underlying tendons. So we want to release these trigger points. We want to relax the muscle and stretch the muscle. If the muscle is more stretched, then there's less tension on the tendons and the underlying tendons and tissue. The patient should experience alleviation of pain after the treatment. Okay, so at this point, after we've diagnosed the knots, you found the knots, we begin to do the acupuncture. And wherever there's a knot, now remember, keep the patient in the stretch position, okay? So the patient remains in the stretch position with the needle insertion. We find the trigger points and we insert the needle. You can do a little probing to the side, in and down, but you do not want, okay, so that's a little probing into the trigger point. Now, as you continue to do them, the patient may experience pain, and part of this procedure may be painful. So what you want to do is you want to just have a shallow or superficial insertion of the needle in the skin. I repeat, you want to remain the needles with a shallow superficial insertion, maybe 0.3 chun as part of the needle. Okay, so I've done my acupuncture. I probed a little bit into these trigger points, and anywhere from, a few needles to 8, less than 8 needles. Anywhere with these knots. The needles remain in place, and while the needles are in place, you're going to ask the patient to do an exercise. So first, to test, you ask them to stand up and down on their foot. So just stand up and down on the heel. You'll see they lift the heel up while the needles are still in place. Up and down, up and down, up and down. So you'll see when you get the needle, you'll see the needles move. As she lifts up, the needles will go up and down. That's helping to break up the trigger points in the tissue. It creates a circulation of blood and oxygen to the muscle. That's what the trigger point does. It restricts the circulation of blood and oxygen to the muscle, shortens the muscle. The muscle becomes a beef jerky-like consistency. Becomes very dry and stringy. That's what the presence of trigger points does. So these needles help to break up these trigger points. Now, as she's lifting up and down, you're going to add a resistance, and this becomes an isometric exercise. So as she lifts up, you're going to resist that motion with your hand down here. This is an isometric stretching exercise. So put the muscle in a stretch, and then add the flexion, but with resistance. That's going to help stretch the muscle. Okay. Now, while the needles are still in place, you can have the patient twist her foot. You can have her stretch whichever way so that she can stretch where the areas of the needles are inserted. So with your foot on the ground, just turn your leg to the side. You can twist and bend. You want to stretch the area of the needle. And then finally, lastly, as a last stretch, you can bring the foot forward, and with your heel this way, lift up your toes. Lift up your toes. So right now she's doing this. She can also bend forward and get a stretch. She can bend forward and get a stretch on these while she's... while she's in this position, you can stretch on this part of the leg. Okay. All right. So this is just a simulated demonstration of the acupuncture technique. As a word of caution, it can be a little bit painful, but the patients will notice a result right away. This is part one. Then you can begin part two of whatever therapy you use. You can do some local points down here after that. So this has been a demonstration of kinetic acupuncture, and any questions, you can look it up. This is a Korean kinetic acupuncture sample demonstration video. This is a video to demonstrate the calf muscle procedure. So we instruct the patient, before the needles are inserted, we instruct the patient to be in a standing position and bring their foot back as far as possible so that the heel is touching the ground. In this position, the calf muscle is stretched. And then we massage going upwards to check for the trigger point tender areas. You want to be careful. Just on touching, even lightly touching, can be very uncomfortable and tender for the patient. And it may surprise them. They may get sweaty, faint, they may pass out just by touching. So there's some tender areas, and where they're at, we'll insert the needles. That's the trigger point areas. So there's two procedures with this technique. The first procedure is that once the needles are inserted, we're going to ensure the patient comfort by asking them to stand up on their toes. They're going to lift their heel off the ground. Go and lift. So by doing that, it flexes the calf muscle to lift the heel up off the ground. The needles are in place. The patient comfort has been ensured. So this is procedure number one. We just simply ask the patient to stand up, lifting their heel off the ground, and we resist with our hand here at the base of the heel. So go ahead and stand up. 1, 2, 3, 4, relax. Go ahead and stand up. 1, 2, 3, 4. Now, as I'm holding here, you can actually press down and counter that force pretty well. Lift up. 1, 2, 3, 4. So I'm stretching the calf muscle here. This will stretch the tendon of the Achilles and all the tendons underlying the carriage of the foot. It will relax the tendons and the tendons under the foot. So that's procedure number one. They stand up and you resist. You can do that 5 to 10 times. Procedure number two, we ask the patient to bring their foot back even further so that the heel is still touching the ground. So bring your foot back further. Heel's touching the ground. Now the patient hasn't been instructed. They're going to push against the wall. And as they push against that wall, that force is going to pass through their entire body and is going to drive the heel further into the ground. And that's going to further stretch the calf muscle. So patient pushes against the wall. That drives the heel in the ground. The practitioner can support that by pushing down. The needle's still in place, and the needles are usually on the medial gastrocnemics, the medial calf. We hold this procedure for 20 seconds. So after 20 seconds has passed, then I usually repeat procedure number one again. I instruct the patient to stand up. Go ahead and stand up. 1, 2, 3, 4, relax. Again, stand up. 1, 2, 3, 4. You can do this procedure 5 to 10 more times. Take out the needles. There's one variation for Morton's neuroma, which is a pea-sized nodule on the bottom of the foot under the balls of the toes. While we're in procedure number two, while the patient's foot is as far back as possible, we can lift up on the toes with our hand. We can lift up the toes, and this will stretch the underlying tendons of the foot and the toes while they're in that 20-second stretch with procedure number two. So you can simply lift up on the toes, which will provide a further stretch for the whole calf, Achilles, and undercarriage of the foot. This is the fountain of youth stretch for the calf muscle that benefits the bottom of the foot. This is the last thing we do after performing the Korean kinetic acupuncture techniques, number 1 and 2. So it's just a manual stretch. We've already had the patient bring their foot back as far as possible. They push against the wall, driving the heel on the ground. The calf muscle is stretched. Now, in that position, we do the pull on the muscle while the muscle is still in a stretch. So they can push against the wall, letting the force pass through the body, driving the heel on the ground. And then what you can do is just take your fingers and pull on the muscle. Now you can position yourself. What I find the best way to position yourself is to go from above, and then you can use your body weight to pull down the hands. Can you feel that stretching there?
Yeah, ouch.
Okay, and you just walk your hands down, especially the medial side of the calf muscle. So you're just pulling on the muscle while it's in a stretch, and you just walk down. So this is the last thing we do with the patient after performing the Korean kinetic acupuncture techniques.
This is going to conclude the video chapter on calf muscle stretching to benefit plantar fasciitis, Achilles tendonitis, Morton's neuroma, pain and arthritic conditions of the toes, and Achilles tendonitis. I really hope you paid attention to this video chapter because, in my opinion, this is the calf muscle is the representation of everything that can go wrong with muscle shortening and muscle trigger point um, presence in the muscles. And it is because of the variety of problems on the feet, um, the neuroma development, the tendonitis, which is plantar fasciitis. Plantar fasciitis is the tendons under the foot rubbing against other tissues, which is causing the pain. Achilles tendonitis is the same thing, just at the back of the heel. Um, so this calf muscle stretch is just a representation of everything going wrong with muscle trigger points and shortening. There can be lots of peripheral nerve impingements coming from the calf muscle stretch when the patient presents with numbness, particularly on the bottom of the feet or the bottom of the toes. This is a really effective procedure, and this is why I want you to pay attention to this chapter. I mean, look it over again. It may be repetitive but this is this is how I almost, because there's so many pain complaints, plantar fasciitis complaints, Achilles tendonitis, numbness of the feet. I think, this is how I built my practice. A third of my practice and my reputation is done by treating these foot problems. And in most of the cases, it just takes one treatment using these techniques to get the results and give the patient relief. So that's why it's a very good, effective technique. It gets patients relief on just the first treatment. And so um, it is a very important chapter. It represents everything about muscle trigger points, which you can apply to every other part of the body. The obvious example would be on the forearm with into the wrist and the fingers, because the forearm and the the lower leg have a lot of similarities. The forearm brachialis goes into the hand, the wrist, as the calf muscle goes into the bottom of the feet. So there's a lot of similarities between the two. Um, so it's just a very interesting technique and very successful with these pain complaints and plantar fasciitis. And one word of caution on the patient is, again, on cold. Cold can tighten up the trigger points on the calf. It can shorten the calf. So just advise the patient against using ice, against going barefoot on a cold floor in the house, being underdressed in the cold weather or cold air conditioning, tossing the blankets off at night with cold air blowing on the feet and the legs. So again, I think it's one of the most important chapters, just this calf muscle into the foot, because it's a representation of everything within a muscle trigger point. Okay, we're going to move on to the anterior tibialis for pain complaints and neuropathy complaints, arthritic complaints affecting the top of the foot, the dorsal part of the foot. This is Korean kinetic acupuncture for the anterior tibialis muscle procedure. The anterior tibialis is for dorsal foot and toe problems, pain or problems on the top of the foot. The root of the problem is the anterior tibialis muscle shortening. And you'll see the trigger point locations in the pink dots on the leg in the picture. The primary muscles for this Korean kinetic acupuncture procedure are the anterior tibialis, and extensor digitorum longus, which contract to dorsiflex the foot and extend the toes. Lift the foot up, lift the toes up. Common problems may be tendinitis along the dorsum of the foot, the top of the foot, and toe malformation like hammer toe or arthritic conditions. There can also be peripheral nerve impingements with muscle on top of with numbness on top of the foot and toes, and of course there can be tendinitis. These can result these can be a result of muscle shortening, adding tension to the tendons along the muscle tendon chain of the top of the foot and toes. There are also two procedures for muscle trigger point release of the anterior tibialis and extensor digitorum longus. The first is Korean kinetic acupuncture with needles, and the second is a stretch only without needles. Now here's a good visual example of what a short muscle and stretch tendons will do. Hammer toe. This is called hammer toe, which also is similar to the arthritic developments where you'll see a patient's toes crossed over, like they're crossing their fingers, only the toes are crossed over one another. So these are a result. Hammer toe picture. A shortened anterior tibialis extensor digitorum longus pulls on the dorsal tendons of the foot, causing the toes to lift and become deformed. Stretch your anterior tibialis. Now, there's a word on cramping too. We didn't talk much about cramping in the video series, but in doing this stretch, which is stretch the fountain of youth stretch, you may experience cramping in the hamstring, back of the thigh. If so, you should do a hamstring stretch, which before doing this anterior tibialis stretch. Now, dehydration as a cause of cramps. So no matter where the cramps, we often think of cramps as dehydration, body fluid deficiency. So in acupuncture and oriental medicine, a cause of cramps may be due to deficiency of blood and body fluids to the muscles, which includes minerals. Do you frequently get cramps? Do you sweat a lot? Do you have a dry mouth? These are patients I often ask my patients. Even if you drink a lot of water, dehydration to the tissues may still occur as the water is not absorbed into the cells. There's a dehydration recipe that we recommend for our patients. Take 1/8 of a teaspoon of pink Himalayan salt, which you can buy at the supermarket, commonly available, mix with 2 cups of water. Drink after sweating, having muscle cramps, or dry mouth. The theory of the pink Himalayan salt is that it has additional minerals which can help absorb the body fluids into the cells better than just drinking straight water, which can flush right through the body. So see if this can help hydrate you better and reduce your muscle cramps. Consult your doctor if you have high blood pressure or are on blood pressure medication before taking this dehydration recipe. So yes, muscle cramping, boy, if you have a combination of short muscles and dehydration, then it's going to set you up for muscle spasms and muscle sprains. So we do always have to consider dehydration in the muscle shortening, and especially like prolonged muscle spasms. Uh, that's a bad combination of being dehydrated with shortened muscles because it can set you up for a prolonged muscle spasm. Okay, so the procedure one for the Korean kinetic acupuncture with isometric exercises. The patient is lying supine on the table with the foot and leg in a stretch, as in the picture above, there and in the picture next to you here on the video. There is no cushion under the knee. The leg is kept straight. The practitioner presses down on the top of the foot and toes to dorsiflex the foot. In the dorsiflex position, the anterior tibialis is stretched. Find the trigger point knotted areas on the anterior tibialis. Massage in a distal to proximal direction from ankle to the knee along the anterior tibialis with the 3 middle fingers firmly pressed against the patient's anterior tibialis. You'll find some trigger points for sure. insert the needles into the trigger point areas of the anterior tibialis. These are the acupuncture points anywhere along the stomach channel, stomach 36 through 40, and gallbladder 34 through 39. Do superficial 0.1 to 0.3 chun insertion. Test the patient comfort level with the needles by moving the patient's foot in extension and flexion direction, keeping the leg straight. Adjust the needle outward if discomfort. Watch for dimples surrounding the needle area inserted during the movement. Dimple areas may indicate discomfort. Adjust the needle outward. Make sure the patient comfort level is assured with a test movement of the foot up and down. And then we begin isometric resistance stretching. Starting in the leg straight and foot plantar flex position, the anterior tibialis is stretched. The practitioner instructs the patient to extend their foot upwards against the resistance of the practitioner. The practitioner's resisting hand is placed atop the dorsal aspect of the patient's foot. To the practitioner's count of 4, the patient tries to extend their foot against the resistance of the practitioner. At 4, the patient is instructed to relax. The practitioner returns the foot to the plantar flex position as far as the patient is comfortable with, and then this exercise is repeated 5 to 10 times. Remove the needles immediately upon the last isometric exercise. Now, here is procedure number 2, which is a stretch only. This is actually fountain of youth stretching. This is what we teach our patients to do if they are able. You'll read the caution here in a moment. So this is a stretch of the anterior tibialis. The practitioner lifts the patient's toes while the anterior tibialis is stretched. Practitioner counts to 4 and then relaxes the stretch, returning toes to the ground. Repeat 5 to 10 times. Nowadays, I just hold the toes up for 15 seconds. I don't repeat. I just hold the toes up and keep them held up for 15 seconds. The caution here: the knees may prohibit the ability to sit completely upon one's legs, especially knee replacement. If somebody had a knee replacement, forget about this. Don't do it. Or if somebody has chronic arthritis in the knees, they're not going to be able to do this stretch. So these are the cautions. Do not force yourself or the patient if there is pain or resistance at the knees. If there is difficulty in doing this stretch because the knees, then do the knee stretch, which we're going to describe in the next chapter before doing this anterior tibialis stretch. If there is pain at the top of the foot doing this stretch, stop the stretch and relax. The muscles and tendons may be too tight in the beginning, and the potential to overstretch, strain, sprain, or tear the muscle or tendon is possible. So these are cautions. You always want to make sure that you're assured of the patient comfort level. Okay, now this is another example of this stretch. And then I do this myself. You can do this yourself. So to stretch the anterior tibialis, sit upon your knees. Sit firmly so the butt is pressing on the back of the legs and heels. From this position, reach under the toes and lift them off the ground. You're going to reach behind you to lift the toes. To further stretch, reach under your toes 1 foot at a time. And then I just hold for 10, 15, 20, 30 seconds. And I do not do the repeat of the lifting and relaxing. So that has since been changed. So just sit on your feet, on your toes, and you're going to really kind of push. You'll feel the Achilles tendon stretch. And then when you lift up the toes, this is an awesome stretch. This is just a fantastic stretch. And it really is going to help with any pain on the top of the feet, arthritic developments to prevent the development of arthritic developments, hammer toe, tendonitis. This is a hugely beneficial stretch, and my patients that are able to do this love it. Okay, so treatment plan triangle for pain conditions affecting the top of the foot, the dorsal aspect of the foot. We talked about cramping, dehydration. So the base of the triangle here is Korean kinetic acupuncture, anterior tibialis procedure number 1 and number 2. So in this case, procedure number 1 is the only kinetic with acupuncture we're doing. Procedure number 2 is the stretch that we're if the patient can sit on their um, knees, then they can do that. And then also, we are going to do the fountain of youth, pull on the muscle while the muscle is in a stretch. So that is also included as this treatment plan triangle. That would be procedure number 3, which is not listed there. So we're going to be putting the muscle in a stretch, pulling on the muscle while the muscle is in a stretch, which you're going to see. That's going to be video 3 coming up ahead.
Alrighty. This is the Korean kinetic acupuncture technique for treating the anterior tibialis muscle, which benefits all kinds of pathologies on the top of the foot. This muscle can get short, the tendons become more stretched, they can pull the toes up, causing arthritic toe development, pains because the tension on the tendons is too tight. There can be peripheral nerve impingements where the short muscle or stretched tendon pinches on the nerve, causing numbness and tingling pain. So we're going to do the Korean kinetic acupuncture technique first, and then we're going to do fountain of youth stretching. There's 2 fountain of youth stretching, and we teach the patients how to do this. So the first thing we do is to check for the presence of trigger points on the anterior tibialis, and we do that by, now what we do is we put the muscle in a stretch. So we're going to bend the foot down as much as the patient's comfortable, and then you can check for the tender trigger points along the anterior tibialis, and there's a few knots here, painful there. So that's where we're going to put the acupuncture needles. You okay? Good. Okay. Okay, so you put the foot in a stretch, you find the trigger point, and then you can insert the needle 0.1 to 0.3 chun. There's a little jump there. Not a bad response, the muscle twitches. It can be painful for the patient, so you always want to check the patient comfort level. And we just kind of walk up and down the anterior tibialis muscle. These are points along the stomach and gallbladder channel and along the trigger points. Are you okay? Okay, so we're going to begin to check the patient comfort level next. So I'm going to check the patient comfort level to make sure the needles are not hurting the patient. If you notice any dimples in the needle, that may be uncomfortable. So to check the patient comfort level, we move the foot up and down. Are you okay? Okay, up and down. Okay, it's a little uncomfortable for the patient, so I'm going to take the needles out just a little bit. Again, these are sitting at about 0.1 to 0.3. Is it better now? Okay, so she says it's better. Okay, now what we do is we put the foot in a stretch, so we're stretching the anterior tibialis, and then, let me take it out a little bit more, she's a little uncomfortable there. Okay, so that's better now, right? Okay, now I'm going to ask the patient to lift the foot up in this direction. Go ahead and lift. Lift up, 1, 2, 3, 4, relax. So we're putting this muscle in a stretch. We ask the patient to lift up, lift up. This muscle contracts to move the foot up, but I'm not letting it move. So the only option is this muscle should stretch. And we do it again, relax. We relax, and then you further stretch the foot down, stretching the muscle, and then lift up. 1, 2, 3, 4, relax. And then a couple more times, we put it in a stretch, and then have the patient lift up. 1, 2, 3, 4, relax. And then one more time, 1, 2, 3, 4, relax. Okay, I'm going to take the needles out. And now I'm going to do the Fountain of Youth muscle stretch technique. Now for this one, this is what we coach our patients to do at home. They can do the stretch themselves by using the left foot and pushing down on the muscle. Now while the patient's doing that, I can have both my hands and I pull on the muscle while it's in a stretch. So we just can walk down and pull on the muscle while it's in a stretch. Good. Okay. And then let's do Fountain of Youth stretch number 2. So the muscle's in a stretch, and while the muscle's in a stretch, you take your fingers and pull down. Now, we're going to do Fountain of Youth stretching number 2. Can you sit on your knees? Okay, so this is a stretch. Be careful with the stretch. Some patients may have some knee pain doing this. The quads may be tight. So the patient may not be able to sit fully back on their feet, but go ahead and sit back. So the patient sits back fully on their feet. You'll see that the foot is plantar flexed, thereby stretching the anterior tibialis. So in this position, again, no needles in place. The practitioner simply grabs at the bottom of the foot and then lifts it up, counting 1, 2, 3, 4, relax. Counting 1, 2, 3, 4, relax. Counting 1, 2, 3, 4, relax. And they may feel a tightness. If this muscle's tight, it may be sore at the top of the foot, the tendons. So be very careful with this. They may not be fully able to sit back. They may be restricted in their motion. So you have to be cautious about this stretch. But if they are able to go back as far as they can, and then you just gently lift the foot up. Try not to lift the foot up too much. Just go with whatever the patient comfort level is. This is the anterior tibialis muscle. It runs on the outside of the leg, and it attaches to the tendons on the top of the foot and then to the toes. If there is pain on the top of the foot or on the top of the toes, there could be a problem here on this part of the muscle. This part of the muscle is short with knots, and it's causing these tendons to stretch and pull on the tendons here. So in order to get rid of the pain here or here or here, we need to stretch this muscle. I'm going to show you how to do that now. Right now, I'm stretching my foot here. My toes are pointing backwards. And all I'm going to do is take my hand and lift the foot up, counting 1, 2, 3, 4, relax. 1, 2, 3, 4, relax.
This concludes the video chapter on Korean kinetic anterior tibialis procedure. Next, we're going to move up the leg to the knee, and we're going to do Korean kinetic acupuncture for knee. This is the Korean kinetic acupuncture procedure for treating the knee. The knee in the picture here, you'll see the quadriceps femoris vastus lateralis and vastus medialis are the targeted muscles for Korean kinetic acupuncture's knee procedure. These are the points represented by the blue squares. The red squares represent acupuncture points liver 8, gallbladder 34, stomach 34, and extra point Xiyan. The blue squares also overlap with acupuncture points spleen 10 and stomach 34. The patella follows a track as the knee is flexed and extended. If there is a malalignment and uneven tension along the vastus lateralis and medialis, the patella can be pulled off track and the alignment of the knee will be pulled off track, resulting in pain and eventual joint deformity such as arthritic development. The Korean kinetic acupuncture knee procedure is done to even the tension and balance for the quadriceps and to keep the patella and the knee joint in alignment and correct. Caution: this procedure should only be done for general knee pain and tendonitis conditions. Do not do the procedure for tears of the ligament or meniscus of the knee. And the reason is because we will be doing flexion and extension exercises with the kinetic procedure with the needles in place. And there can be a meniscus tear can structurally just obstruct the movement of the joint. It blocks the movement of the joint. So you want to be careful with tears of the tendons, ligaments, or meniscus, and just work with the patient comfort level as usual. Now, one other note, trigger point release. On the knee, on the area of spleen 10, which is on the medial side of the knee, just above the patella, proximal of the patella. That is a common area, spleen 10 and the point just above that. Those are common areas for trigger point release, for trigger point technique. So you can do a lot of trigger point release on those areas and even down further along the medial side of the vastus medialis. A lot of trigger point releases there, but that can be surprising to the patient, and it can be a little painful and uncomfortable for the patient. But if you get them, you got to caution with the patient comfort level, but you're going to actually get good results with this trigger point release. And then you do the kinetic acupuncture procedure as well. So the acupuncture procedure preceding Korean kinetic acupuncture. Before the Korean kinetic procedure is performed, the licensed acupuncturist can insert stomach 35 and extra jian up to zero point 0.5 to 1 chun depth in the knee flexed position. This goes right into the cavity of the joint, and it can help with the fluid retention of the joint or stimulation of lubrication of the joint. Remove these points before beginning the Korean kinetic acupuncture technique. Points liver 8 and GB 34 can be left in during the kinetic acupuncture procedure. Like the shoulder technique, these acupuncture points are not muscle centric, but in line with the traditional theories and constructs of acupuncture, which is to open up channel blockage and obstruction. So here is the procedure with the knee. The patient is lying supine with the knee flexed and supported underneath by a cushion or pillow. Find the trigger points in the knotted areas of the quadriceps, lateralis, and medial. Massage in a distal to proximal direction with the 3 fingers firmly pressed against the patient's quadriceps. Insert the needles into the trigger point areas, 0.1 to 0.3 chun. Test the patient comfort level with the needles by moving the knee in a flexed and extension direction. As per the picture below, you'll see the 3 positions. There's a flexion of the knee. These are going to be the movement directions that we're going to do kinetic acupuncture in, and then we're going to add an isometric stretch down there, but we'll talk about that. Adjust the needle outward for discomfort. Watch for dimples surrounding the needle insertion area. Dimple may indicate discomfort, and adjust the needle outward. Patient comfort with the needles has been assured with a test movement of the knee. So, kinetic movement number 1 for the knee. The practitioner holding the patient at the ankle and supporting the knee gently rocks the knee in a lateral and medial direction at the same time as moving the knee in flexion extension up and down. The gentle rocking motion in lateral medial plane can be achieved by the practitioner grip at the ankle. So practitioner gently rocks the knee in flexion extended motion while rocking the knee or swiveling the knee medial and lateral. Begin kinetic acupuncture isometric resistance for the knee. Using the different levels of flexion and extension, no longer gently rocking the knee, the practitioner instructs the patient to extend the lower leg against the practitioner resistance at grip point of the dorsal ankle of the foot. By extending the lower leg, the quadriceps contract. Resistance doesn't allow for the movement of the lower leg, so the quadriceps will stretch and balance in lieu of extending the leg. The patient should not be lifting from the hips, which they may try to flex to move the lower leg. Be watchful that only the lower leg is being extended, that only the quadriceps are the muscles being fired. The Korean kinetic acupuncture's isometric resistance treatment should be done at different levels of the knee flexion position. In the 3-panel picture just shown, the isometric resistance can be formed at each of these levels with the patient trying to extend their lower leg against practitioner resistance. 2, the practitioner's count of 4, the patient tries to extend their lower leg against the resistance of the practitioner. At 4, the patient is instructed to relax. The practitioner either repeats the procedure at the same level or moves the knee to a different level of flexion. This exercise is repeated 5 to 10 times. After the procedure has been performed, needles may either be removed or retained depending on practitioner choice for following therapy. So yes, quite often I retain the needles and I continue on with the acupuncture technique with those needles retained. So here is the treatment plan triangle for knee pain. We start at the acupuncture points of Xi'an, stomach 35, where we insert in deeply into the joint cavity to provide lubrication of the joint. We take those needles out, and then we begin the Korean kinetic acupuncture procedure with both the just movement, flexion, extension with the gently rocking side to side, followed by the extension, isometric resistance of patient extension against practitioner resistance. We can do, and then practitioner's choice, and then the fountain of youth stretching. We'll see some stretching pictures, and during the stretching, you can also do pull on the muscle while the muscle's in a stretch. So these are the stretches that we teach our patients to do after the treatment. Patient self-stretches for knee pain, taken from the Fountain of Youth stretching book. You can do Korean kinetic acupuncture technique with this exercise. So yes, sometimes if the pain is stubborn, I'll insert the needles while the patient is standing and performing this stretch. So have the patient flex the knee as fully and comfortably before inserting needles, and then follow with an isometric stretch. So we can do the kinetic acupuncture in the standing position. I've done it in the past. Lift your foot up behind you as close and snug to the butt as possible. Leg may be unable to flex fully. Stop when there's pain or resistance. You will feel the stretch of the quadriceps. And then you can add the isometric stretch. Push the foot against your hand as the knee is in the flexed position. Resist the movement of the foot with your hand. Quadriceps contract to extend the foot. When we resist the extension with our hand, the foot will not move. The only outcome is that the quadriceps will stretch. In the picture above, I am pushing my foot and leg down against my right hand. My right hand is resisting that motion. Thereby, I end up stretching my quadriceps. Now, some patients will not be able to fully flex the knee all the way back, especially like a knee replacement, but many patients just won't have that flexibility. So you can stretch the knees at different levels, particularly if there is difficulty bringing the leg and foot all the way back. By stretching at the knees at different levels, you also notice the stretch along different levels of the quadriceps muscle. Keep doing the isometric component at these different levels.
Okay, we're going to do Korean kinetic acupuncture technique for the knee procedure. So it's all about balancing the quadriceps on the lateral side and the medial side. Now, one thing about the knee procedure is on the front side around spleen 10, there can be trigger point releasing techniques where the muscle may jump and twitch. So a lot of times on spleen 10, we get trigger point release, which is a good response. It's like the muscle's untying itself of the knots, and it's going to stretch the muscle. But what we're going to do is we're going to find the trigger points along the medial and lateral quadriceps, and then we're going to do the Korean kinetic knee procedure. Okay, so like I said, right here, quite often we'll get a muscle twitch response. So you can do a little bit of probing with the needle, and you may get the muscle twitch response, and then a little bit on the medial quads. Okay. Are you okay? And just kind of work your way up. Good. Good. And we insert the needles about 1.1 to 0.3 chun. And then once we find the trigger points and all the needles are in place, we're going to do the kinetic procedure. And the first thing we do is we check the patient comfort level. So we're going to bend the knee. Now, if the needles hurt, where does the needle hurt? There's a little dimple right here. That's where the needle can hurt. So we take them out a little bit, and we're going to bend the knee on the inside. Okay, we'll still take them out a little bit. Okay. And then we're going to bend the knee. Is it okay? Relax. Bend the knee, bend all the way. Okay. Okay, so the patient comfort level has been assured. And then what we do is we have the patient lift their lower leg up like that, but we're going to resist that motion. So I'm going to instruct the patient, lift the lower leg up against my hand. Go ahead and push up. 1, 2, 3, 4, relax. And then relax. We can do it from here, push up. 1, 2, 3, 4, relax. So we're putting the quadriceps in a stretch here. And then we're doing the isometric stretch where the patient lifts up the leg. Go ahead and lift up. These muscles contract to lift the leg up, but I'm not letting it. So the only option is they stretch. And you can kind of shake the knee around and move it up and down. And then Okay, and then push up again, please. 1, 2, 3, 4, relax. You can do this about 5 to 10 times. Just push up, 1, 2, 3, 4, relax. Okay, and then we'll take the needles out. Good. And then you could do practitioner choice at this point. And then we do the knee stretch, which I'll show pictures of the knee stretch. So this was the Korean kinetic procedure for knee pain, releasing the quads to benefit the knee, to realign the knee in proper alignment.
Okay, after the Korean kinetic acupuncture procedure has been performed, you can teach your patients to do the knee stretch themselves. And don't expect them to bring the foot all the way back where it's touching the butt. In this picture, notice also how my foot is stretched. This is also a stretch of the anterior tibialis muscle. Do you remember that chapter? So this is both a quadriceps stretch and an anterior tibialis stretch, just positioning my foot that way. So also you can do the knee stretch and then the practitioner can pull on the muscle while the muscle's in a stretch. So try that technique out. That's a very effective technique to really straighten out the quadriceps and get a good stretch to realign the knee and give pain relief. This concludes the video chapter on Korean kinetic acupuncture for the knee procedure. Next, we're going to move up to the hip and particularly the lateral side of the hip for the IT band tensor fascia latae. This is the Korean kinetic acupuncture treatment for the lateral side hip, the iliotibial band, also known as the IT band, the tensor fascia latae muscles. So I'm starting here with the treatment plan triangle because we can, before we do the kinetic procedure, we can do VST acupuncture across the lower back or practitioner's choice. So with the hip, a lot of times, well, very seldom is just the hip isolated unto itself. So there's usually a very comprehensive back treatment involved with this. So we do VST for the back, which incorporates the points along the urinary bladder line, along the five lumbar vertebrae, points along the urinary bladder points in that area, gallbladder. We do a lot of the gluteus muscles, maximus medius, and it may even incorporate piriformis muscles. And so then we also do local acupuncture on the lateral side hip. There can be gallbladder 30, 31, points along the gallbladder channel, along the IT band, the iliotibial band. So we do this passively with the VST acupuncture. Wherever the patient has pain, we will do the local acupuncture. And then after that, we will do a therapeutic lumbar technique, which I'm going to show you shortly. And then we follow that up with the IT band kinetic acupuncture hip IT band procedure. The IT band tensor fascia latae for hip joint kinetic procedure. This is the position which the Korean acupuncture IT band hip joint procedure is performed in. Notice that the left leg crosses over the right knee. The left hip is internally stretching the tissues of the IT band. So that's going to be the position, and we can needle in that position. You don't need to needle in that position, but you insert the needles along the area of pain on the IT band and the tensor fascia latae, and then you cross the leg over the opposite knee. So you're going to see that in the video coming up. That's going to be the position from which the kinetic acupuncture procedure is performed. And then to do the procedure, in the position above, the patient is supine with their knee flexed and the leg crossed over the opposite knee. Needles may be inserted before crossing patient's foot over opposite knee. Find the trigger point, knotted areas of the hip and IT band. Massage in a proximal distal to distal direction from the hip to the knee with the 3 middle fingers firmly pressed against the patient's IT band. Insert the needles into the trigger point areas of the hip and IT band at a 0.1 to 0.3 chun depth. Test the patient's comfort level with the needles by moving the patient's knee in a medial and lateral direction, external and internal rotation of the hip. Adjust the needle outward if there's discomfort. Watch for those dimples surrounding the needle insertion during movement. Dimple areas may indicate discomfort. Adjust the needles outward. So once the patient comfort level with the needles has been assured with the test movement, you can begin the procedure. And we begin the isometric resistance. So we cross the leg over the opposite leg, and we're stretching the hip and IT band. And so starting in the position above, the practitioner pushes against the lateral side of the knee to further interiorly rotate the hip as far as the patient is comfortable with. At the furthest point of the stretch, the practitioner instructs the patient to push their knee, externally rotating the hip against the practitioner. The practitioner's resisting hand is placed on the lateral part of the patient's knee. To the practitioner's count of 4, the patient tries to laterally push their knee, externally rotate their hip against the resistance of the practitioner. At the count of 4, the patient is instructed to relax. The practitioner returns the knee and the hip to the interior rotated position as far as the patient is comfortable with, and this exercise is repeated 5 to 10 times. Remove the needles upon the last isometric stretch, resistance stretch. So simple procedure, you cross the leg over the opposite knee, and then you push the knee so that you're internally rotating the hip as far as the patient is comfortable with. You can get a good idea of the range of motion in arthritic conditions. Some patients have really good range of motion. You can really cross the leg far across the body. And then from that furthest point of stretch, you begin the isometric resistance stretch where you instruct the patient to laterally push the knee, which is a externally rotating the hips. So they push the knee against your resistance. And we will show the video of this now. Okay, we're going to do the Korean Kinetic Acupuncture for the hip and IT band, tensor fascia latae. So this is for pain on the outside of the hip that the patients may have. And so the first thing is you put the hips in a stretch position. We're going to cross the leg over and the hips in a stretch position. And then we're going to insert the needles on the painful trigger point areas along the IT band. Okay, there's 2 needles right here. They're hard to see. Okay, I'll get a picture of the position here, crossing over, and then you push 1, 2, 3, 4, relax, and then push 3, 4, relax, push. So all the needles have been in place here. My IT band and my hip is stretched because I've crossed my leg over. Now we're going to do the isometric stretch. And my wife will push the leg over as far as she can. And then I'm going to push with my leg. 1, 2, 3, 4, relax. And return back to stretch. We're stretching these muscles. Now we instruct the patient, push the knee in that direction. 1, 2, 3, 4. These muscles are contracting to move the knee, but she's not letting my leg move. So the only option is they stretch here. So we stretch, go as far as your patient is able and comfortable, and then push 1, 2, 3, 4, relax. And then again, push 1, 2, 3, 4, relax. This concludes the Korean Kinetic Acupuncture video chapter on the hip IT band procedure. Next, we're going to go into the piriformis technique. This is the Korean Kinetic Acupuncture technique for piriformis syndrome. Now, I did a lecture at the Florida State Oriental Medical Association in 2021, and I did a presentation on piriformis syndrome. So I'm going to do the recap of piriformis here, but for the demonstration, I want to encourage you to go to the video, which is available on Net of Knowledge. There's a link in the down there on the first page. And you can also go to lhasa.com or for other acupuncture websites around the world. There's acupuncture CU providers. You'll see the video there. It was Florida State Oriental Medical Association 2021, a presentation on both PTSD using SIAM acupuncture and piriformis syndrome using kinetic acupuncture. Now, during that presentation, we did do a demonstration where I did a acupuncture treatment for a gentleman that had piriformis syndrome symptoms. So you can see the video demonstration in that video. I'm not going to be doing an elaborate video demonstration on this video, but there will be a short video on this one showing the basic run through of treating piriformis syndrome with Korean kinetic acupuncture. So piriformis. The piriformis muscle originates from the anterior sacrum and the greater sciatic notch of the ilium and inserts into the greater trochanter notch of the femur. It externally rotates and abducts the hip. The piriformis is located about the mid-level of the gluteus muscles, halfway between the posterior iliac crest and lower buttocks. So here's a Statue of David picture. There's an approximation of the piriformis. You'll see it attaches to the inside of the femur, the hip, at the hip. So this treats inside of the hip joint pain attaching to the sacrum. So you'll see patients pointing to this area of pain, and you'll have an idea it's piriformis syndrome. And then piriformis muscle for lower back and hip joint from fountain of the youth stretching. So the piriformis is an agonist muscle for external rotation of the hips and abduction, meaning as demonstrated in this picture below, when the hips flare out like a frog, the piriformis is fully contracted. In order to stretch the piriformis, we must do the opposite, which is to internally rotate the hips. So the piriformis contracts to initiate external rotation of the hip, which is what this position is. This is external rotation of the hip. The piriformis is contracting. It's the agonist which initiates this range of motion. This motion. Now, the normal range of motion for external hip range of motion. Do you remember this from the VST presentation? Is 45 degrees. So, as a visual representation, I drew a little picture of a frog, kind of imagining them that they sit with their hips externally rotated. So the frog is saying, my hips are externally rotated. My piriformis contracts to externally rotate my hips. In order to stretch my piriformis, I will have to do the opposite of this, which is to internally rotate my hips. And here's two pictures of internal rotation of the hips. The bottom picture is the better picture, but it gets a little confusing for some people to know which is internal and which is external. So the frog is external rotation. And then if you look down, I'm lying flat on the floor there, and my hip is internally rotated. This is the piriformis stretch. Remember, in the external rotation, the piriformis is contracted. Now, in the bottom picture, the piriformis muscle is stretched, and the normal range of motion is 40 degrees. Now, I do piriformis technique number 1 in this position, and this is in the video demonstration from the FSOMA conference in 2021. I have the demonstration of acupuncture doing this, where I do isometric resistance exercise in this position where I'm on the patient's on their stomach, their hip is internally rotated, the needles are in place at the piriformis, and then the patient is instructed to externally rotate the hip in this position against practitioner resistance. That's piriformis technique number 1. It's not demonstrated in this video, but you'll see it in the FSOMA video. Okay, now there are two types of sciatica. Bulging discs of the vertebrae are the most commonly referred type of sciatic pain, although I think they're more commonly understood. Most people don't understand piriformis sciatic, and they always think it's a bulging disc, which it's not. Anyway, bulging disc of the vertebrae are the kind of like the most commonly thought of referred type of sciatic pain. This usually presents with severe pain at the lumbar vertebrae, followed by a tract of pain going down the lateral hip to the legs and feet. This type of sciatic pain is usually constant 24 hours a day, 7 days a week, with little positional relief. Piriformis syndrome is a peripheral nerve impingement of the sciatic nerve, meaning the nerve is being impinged outside of the spinal column. As the sciatic nerve travels south from the spinal cord, it travels through in a foramen or in the muscle or just adjacent to the piriformis muscle located in the mid to lower gluteus region. The piriformis can become tight, sticky, and short due to trigger point pathology. I liken it to a piece of saltwater taffy where the piriformis can become very thin and sticky, and it's a stubborn one. It can just linger on if you don't know how to stretch it out, which we're going to teach. As it shortens, it impinges on the sciatic nerve, triggering the sciatic-like pain. Piriformis syndrome can be distinguished from a spinal disc problem by the following. Piriformis syndrome originates from the gluteus region, not in the spine. In many cases, the patient may not have any pain at the lumbar vertebrae at all, and it tracks down the back of the thigh, sometimes going to the leg and the foot. The radiating pain of piriformis syndrome may be intermittent with periods and positions of being on or off. Positional relief may be found between sitting, standing, or sleeping. So some people find comfort in sitting, others don't. Other people find comfort in standing or walking, and other people don't. So it's an on and off kind of thing. Piriformis syndrome frequently affects elderly and those who have been sitting for prolonged periods of time. Travel, road trips, truck drivers, snowbirders, and sitting in chairs that pinch at the buttocks can cause piriformis syndrome. So here's a representation comparing sciatic from piriformis. You'll see the sciatic on the left, tracking on the red with pain at the lumbar vertebrae, going down the back of the leg, down the whole leg, basically. There's going to be severe pain, usually affecting younger people, actually. And that could be Dr. John Sarno syndrome, which we talked about in the Sam acupuncture class. Pain is usually constant, severe, with no positional relief found. Hurts walking, sitting, and sleeping. On the right is sciatic from piriformis, which tracks in green down the back of the buttock area down to the leg. May have no pain at the lumbar vertebrae. Pain tracks down from the mid to lower buttock down the back of the thigh, may radiate to the lateral side of the lower leg to foot. Pain may be bilateral. Pain may be intermittent with positional relief found. Happens frequently to elderly people or those who have recently traveled on long road trips or from sitting in a chair or car that compresses on the lower buttock region. So this is piriformis technique number 2. Now I mentioned number 1. We don't show it here, but it's in the previous video as well as in the demonstration. So this is piriformis technique, kinetic technique number 2. In the treatment plan triangle, the technique comes after piriformis technique number 1, which includes also local acupuncture. When we do piriformis, we're often doing VST, a very comprehensive back treatment, kind of covering the glutes and the piriformis region. We do a wide coverage of the glutes, piriformis, along the UB channel if there's pain there. After these procedures are performed is when piriformis technique number 2 is done. This technique is not shown in the treatment plan triangle above. Well, we'll see. Patient is lying supine. Position them in the piriformis stretch pictured below. In this picture, we are stretching the patient's left side piriformis, which is where the needles are placed. After positioning the patient in the stretch position, the practitioner will insert the needles. So you put the patient in a stretch position and you insert them in the area of green. You can have the patient point their fingers where the pain is, and you can wherever they point is an ashi point. You can do acupuncture with this. So here's another representation of the isometric stretch of piriformis. The practitioner pushes the knee as close as possible to the chest. From the full stretch position, patient pushes knee laterally against the resistance of the practitioner hand or arm. The piriformis muscle contracts to move the knee laterally. Because of resistance, the knee does not move, so the muscle will stretch. And the needles are inserted in that area down there, marked in the right side, and you could have the patient point with your trigger point. So this is the isometric stretch. You're crossing the legs, you're bringing the leg up to the chest. That stretches the piriformis. The patient is instructed to push the knee outwards, laterally, to the side, and the piriformis is contracting to move the hip, but the practitioner resists, so the only option is that the muscle will stretch. This is the isometric stretch. You can repeat this technique 5 to 10 times, and then you can do it without the needles. Now, in order to assist with the needle placement, you can ask the patient to point where the muscle is tight. They will point to the area surrounding the piriformis muscle, the lower glutes, and possible upper hamstring. These are the areas marked in the picture above. Practitioner then pushes knee as close as chest as possible, and from this full stretch position, patient pushes their knee without using their hands laterally against the practitioner's hand or arm. So this is the isometric stretch. Immediate results should be expected with this kinetic acupuncture treatment. Now, one note, this stretch can also be done in the sitting position without the needles. So in the seated position, and this is shown in the video demonstration from the conference, you just cross their legs, and in the cross-legged position, you bring the knee up to the chest, and then they can do the resistance, pushing the leg to the side against the resistance. The caution is in this picture, the picture demonstrates location with clothing. Do not needle through clothing. It is dangerous, particularly with movement, and counter to the clean needle technique. Do not needle through clothing. And then we have the treatment plan triangle, which we start with VST covering the lower back, very comprehensive in the prone position. We can do the piriformis kinetic technique number 1 in the prone position. We're going to talk about therapeutic lumbar technique in the next chapter coming up very soon. And then we can do this following technique, piriformis number 2. And then following that, we do a kinetic decompression, which we're going to finish up the video showing our kinetic decompression stretch, that kinetic hanging stretch. So following is a video demonstration without needles, but I would definitely refer you to the Florida State Oriental Medical Conference to get a really comprehensive discussion on piriformis syndrome, as well as the demonstration of the technique.
This is a sample video demonstration technique for the Korean kinetic acupuncture technique. We're going to do a piriformis demonstration. So the patient would be exposed. We're not going to be exposing any part of the body here, but the piriformis generally, it attaches at the greater trochanter of the hip, and then it runs in a kind of triangular pattern to the base of the sacrum and the top of the sacrum, so, or even the coccyx. So it runs in this direction. It's about along the medial glute areas, and so you can find the trigger point areas and insert the needles along the piriformis muscle, just like along a line here and here and here. So then, once the needles are in, you're going to take the patient's leg and interiorly rotate the hip. So right now I'm interiorly rotating the hip. The piriformis muscle stretches by interiorly rotating the hip. I'm going to ask the patient with the needles in place to externally rotate the hips by pushing the foot in a medial direction. But I'm going to resist that motion. So if you have your fingers without the needle, you can ask the patient to push, make sure the patient pushes in this direction, that they're not pushing down towards the ground. So when the patient pushes, you can feel with your finger the piriformis muscle contracting. So go ahead and push. 1, 2, 3, 4, relax. And once again, the patient comfort with the needles has been assured. You've tested the range of motion with the needles in place. Internally rotate the hip. The patient pushes. Go and push. 1, 2, 3, 4, relax. and then you return the hip to anterior rotation. Go in and push 1, 2, 3, 4, relax, relax, and go in and push 1, 2, 3, 4, relax, and again 1, 2, 3, 4, and you'll be able to kind of feel these muscles contracting. So again, the piriformis muscle, when we internally rotate the hips, that stretches the muscle. The piriformis contracts to exteriorly rotate the hip. So we're putting it in a stretch, we're asking it to contract, but we resist, so the foot doesn't move, the muscle contracts, and that will stretch the piriformis.
This concludes the video chapter on Korean kinetic acupuncture for piriformis syndrome procedure. Next, we are going to do the TLT, therapeutic lumbar technique, with an acupuncture and back stretch. We're going to talk about Korean kinetic acupuncture's therapeutic lumbar technique. So we've mentioned this TLT procedure a few times already, with both the IT band hip joint stretch and as well as the piriformis stretch. And it is located in these treatment plan triangles at some point. So generally, whenever we do a lower back treatment, we will be doing a TLT. This involves both an acupuncture procedure followed by a manual back stretch. So the acupuncture procedure is we needle, and this acupuncture procedure can needle the quadratus lumborum and also target the psoas muscle trigger points. So in order to map this out, if you look at the picture here, we're going to map the location, and it's at the midpoint between the 10th rib and the ASIS. And so if you look at the red X, that's just the mapping point. That's the center point between that's the center point between the 10th rib and the ASIS. So from that point, then, and you'll see in the bottom picture, that's just the mapping point. That on my right hand, I'm finding that point, and then with my left hand, I run my two fingers down until we come to the quadratus lumborum and oblique muscles. So where you find the ridge of those muscles, which is about 1.5, 2 chun away lateral to the spine, that's going to be where we insert the needle. The insertion point is the same point as UB24, 2 chun lateral to the midline. This is an oblique, superficial, or perpendicular insertion, and we can go 1.5 to 2 chun. You needle towards the spine. Do not angle in an anterior direction towards the internal direction. So this is really just a perpendicular insertion, but it is oblique and superficial. You definitely be careful. Don't needle anteriorly. You're needling towards the spine. So you find the point, you insert the needle, and then you quickly remove the needle. So this is a way to target the quadratus lumborum, which is, if you remember from the VST series, the ability to laterally bend at the hips is an indication of a quadratus lumborum restriction. So we needle this, and this is just a quick needle technique. We just insert the needle and quickly remove the needle. We do not retain the needle. And then after doing the needling technique, we follow this up with a manual back stretch, which I'm going to show you the video of. I'm going to show you the video of both the needling technique and then the therapeutic, the back stretch that accompanies TLT. So TLT is made up of two procedures. The first is the needling technique into the quadratus lumborum, psoas muscle, and then it's followed by the gentle lower back stretch, which both will be demonstrated in the video next. This is a video demonstration to support techniques and procedures used in the book Korean Kinetic Acupuncture, Acupuncture's Next Generation Muscle Trigger Point Technique by Dr. Evan Mahoney.
In no way should this be used by those without completed education, license, and degree in the curriculum of acupuncture and oriental medicine. Further training is recommended before one should begin practicing these techniques. The author takes no responsibility for mistakes or medical errors caused by those practicing these techniques. This video will not have needle insertion demonstration. For purposes of this book, these techniques should only be used for complaints of pain unless otherwise stated. It is to be understood that the practitioner using these techniques has a full understanding of acupuncture safety, contraindications, and proper needle location and insertion depth. This is a demonstration video for Korean kinetic acupuncture technique, a demonstration of therapeutic lumbar technique, procedure number 1, needling of the quadratus lumborum muscle for lower back pain. So we find the quadratus lumborum muscle. It's centered between the ACIS, anterior superior iliac spine, and the 10th rib. It's positioned right in the middle. Relax your arm. Okay, so find the ASIS and the 10th rib. Position yourself right here. This is a mapping point. And then run your fingers down to the erector spinae. And it's right there. We can needle 1.5 to 2 chun, and you want to needle obliquely. This is obliquely, although in this position it looks like it's perpendicular, but it's really an oblique insertion. And then after doing the needle, I'm going to do a gentle back stretch. And we just traction the shoulder. We're not pushing, we're just holding in place. And then with your hand, you stretch the back. And do it with the patient breathing. Take a breath in, breathe out, and just gently relax. Good. I like to do this 3 times. Take a breath in, breathe out. Try to relax. Good. And then one more time. Take a breath in and breathe out. Good. So this is therapeutic lumbar technique. It's the QL muscle followed by a back stretch. Okay, so going back to the treatment plan triangle, an order of procedures of lower back. So if somebody comes in for just generalized lower back pain, there's no sciatica, it's just a local pain along the spine, we'll do local acupuncture along the urinary bladder. This is kind of like your standard acupuncture treatment. This is a practitioner's choice. When somebody comes in with lower back pain, you can do practitioner choice, local acupuncture along the painful areas, along the urinary bladder, the Yashi points, gallbladder. So we do that. We'll have the patient lie prone with the acupuncture needles for about 20-25 minutes under a heating lamp. And then the next order of procedure after taking those needles out is that we do this TLT procedure, doing the insertion of the needle as well as doing the gentle back stretch. So then following TLT, we do the kinetic hanging back stretch for the lower back. So that's what we're going to be showing in the next video, is the kinetic lower back hanging stretches as well as psoas muscle stretches. And to keep the back in good health for the rest of the life, if you do these kinetic back stretches, it'll keep your back in good health for the rest of your life. So we're going to begin the discussion on that. And these back stretches are how we finish our lower back pain treatments. We teach our patients how to do these coming stretches, and if they can do them on their own, they're going to keep their back in good shape. They're going to be out of pain, and they're going to very much appreciate you teaching them these techniques. So I hope you enjoy the last chapter, which is these hanging back stretches for lower back pain. It's the final procedure in the treatment plan triangle.
Kinetic Acupuncture, the hanging lower back stretch. The Korean Kinetic Acupuncture Fountain of Youth Hanging Back Stretch. Kinetic decompression stretch for lower back, also known as Kinetic D Hanging Back Stretch. This is a practice and procedure derived wholly from acupuncture by acupuncturists for use with acupuncture. This works best after acupuncture has been performed, which makes the body and muscles much more relaxed and pliable for this stretch. The genesis of Kinetic D Hanging Back Stretch. During my doctorate clinical training at Samra Acupuncture Center's Specialty Pain Management Clinic, we performed our kinetic acupuncture lower back procedure. This is briefly described in the Samra brochure under Mobility Plus chapter. Needles would be inserted into acupuncture points on the elbows, feet, neck, and lower back. The patient would then be instructed to do a march while the needles are in place. The march entailed swinging the opposite arm as the opposite leg stepped up high. The head was held high and the back straight. The patient was instructed to imagine a piece of string pulling them up to the sky from due 16 acupuncture point as they did their march. And there was an acupuncture point in due 16. The acupuncture points are due 16, LI4, LI11, due 4 on the spine, and we would do stomach 36, or and also liver 4 or liver 3. Sometimes in the more difficult cases, the patient had to be supported by two of us in order to do the march. You will see the picture of this in the bottom right-hand corner of the brochure page, with a practitioner holding up the patient from underneath each shoulder. They would essentially lift the patient up as they did the march around the clinic. And in that picture down in the right-hand corner, you'll see the gentleman in the red shirt. On one shoulder, under his left shoulder, he's supported by Dr. Hyung-Suk Choi. Well, this was my job during Samra Acupuncture Clinic. In my book, Eliminate Back Pain, Hang from a Tree, I describe my experience of getting back pain at the beginning of my internship with Samra Acupuncture Center, and noted the difficulty of me at 6'2" having to stoop low in order to lift the patient up and walk them around the clinic. And yes, at that point, I had my bulging disc, which our MRI machine up there in the upper picture detected an 8 millimeter bulging disc in my L4, L5, and I was suffering severe sciatic constantly during my first 6 months in the clinic. So I was both a patient and a practitioner. And with my back pain, I would be lifting patients up and stooping low, and we would be doing the march around the clinic as I also had extreme back pain at the same time. But it was a great experience because I got to learn both as a patient and a practitioner, and I got to emphasize with my patients. Now, part of my healing recovery, we also had an inversion table in Samra Acupuncture Center. And so we had used the inversion table as part of our service, which I used to greatly benefit during my back during my internship. The inversion does two things, both of which can be accomplished with kinetic decompression lower back stretch. It creates separation between the vertebrae. It stretches the lower back muscles. By hanging upside down, it juxtaposes the constant compression from gravity upon the back in the upright, standing in the upright or sitting in the upright postures. Later, when I moved to Florida and again had a return of severe sciatic with slight foot drop, I used this principle of elevation and inversion to create the simple and straightforward eliminate back pain, hang from a tree back stretches. Now, a note on the inversion table. At Samra Acupuncture Center, we had a face down inversion table, and we would put the patient on the inversion table face down, and we would do acupuncture as they're hanging upside down. So we use the inversion table with acupuncture with the decompression stretches. The inversion table is a decompression stretch, and we used acupuncture with that. So yes, I do acupuncture with my Kinetic D hanging lower back stretch. So it would have been in Florida, it would be impossible for me to elevate and support patients single-handedly like we did in Los Angeles. So I created the Kinetic Decompression Lower Back Stretch Tool. The Kinetic Decompression Lower Back Stretch Tool is comprised of 3 items. 1, a pull-up bar, chin-up bar, or you can find a tree limb or jungle gym jungle gym monkey bars to stretch from. But in the clinic, a pull-up bar or chin-up bar, you can buy them at the sporting goods store or online. 12 to 15 feet of rope, nylon, I use a 1/2 quarter diameter rope. I use nylon, it's very strong. And then 1 swimming noodle with a 2 to 3 inch diameter in the middle. There's swimming noodles will have a hollowed out middle through the length of the swimming noodle. So you thread the rope through the swimming noodle, and then I tie knots at the end of the rope for grip handling. And so we have a swimming noodle with a rope and a pull-up bar. So instructions on how to use. Do not exceed the weight restrictions of the bar you are using. To more easily hold the weight of the patient, wrap the rope 2 to 3 times around the bar. This is a double sailing technique. It's a double block technique where if you wrap something twice around a block, you can lift it up a lot of weight very easily. So ensure the strength of the rope. Ensure patient comfort, especially with the shoulders, because you will be placing the swimming noodle under their shoulders. Use with caution or do not use if the patient has any history of neck or shoulder injury or damage. Concern for the shoulders is of the utmost importance. So with the patient standing under the bar and facing the practitioner, place the swimming noodle under the patient's shoulder. Wrap the loose ends of the rope 2 to 3 times around the bar, and you'll see down at the bottom there's the double block sailing block technique where you wrap a rope twice around that block, and that'll allow you to lift a lot of weight very easily. So caution the patient about shoulder comfort. If there is pain or discomfort, have them stand up immediately. So have the patient bend their knees and walk their feet in front of them, assuming the posture in the picture 1 of this chapter. We'll show the picture next to this page on the video. Patient's feet should always be touching the ground. Instruct the patient to relax the muscles from their belly button down and let the weight of gravity pull the lower back down. Discourage patient from swinging or rocking while doing the stretch. They should remain still as they relax the back. Hold the position for 10 seconds. When the patient stands up, now you may want to caution the patient because of the knee. There can be knee discomfort standing up. They may not be able to support themselves if they have a history of knee pain. So I have them walk backwards when they go to stand up, just shuffle backwards and or just pull themselves up by their arms on the rope. So when the patient stands up, have them walk in place, lifting their legs as high as possible. This is the Samra march that we would march the patient around the clinic. So I do this with the swimming noodle. I just have them march in place. Assess the patient. And then I repeat this. I actually just do the stretch 1 more time. So I do this stretch twice. So initially the muscles may resist doing the stretch and the patient may not get a good stretch, but they will. They will get a good stretch. Upon repeating of the stretch, the muscles understand better and begin to stretch better. Instruct the patient in the self-stretches of eliminate back pain hang from a tree, which is comprised of 2 stretches. We're going to show those in the video following, in the pictures following. One particularly beneficial for the psoas muscle. So here's the double block. Based on the double block principle in sailing, the rope passes once, twice, or greater through the block twice. It passes twice through the block and allows for easy lifting of greater heavy weights. Alrighty, and then here's the picture. Notice the double wrap around the bar where I'm holding. I've wrapped the rope twice around the bar, and I'm able to hold the patient up with one hand. The patient's legs are brought forward. So this is the position that the patient drops and relaxes their back. The kinetic decompression stretch for lower back allows for a variety of other hip joint mobilization techniques, which you referred to the eliminate back pain, hang from a tree. We're not going to be showing those here. And fountain of youth stretching for other possibilities with decompression stretch for the lower back. So this is the technique. You just put the swimming noodle under the shoulders. You have them drop until you lower it until they can feel the back stretch. There's kind of a pocket where the patient will drop into, and then you just count off 10 seconds. And then when they go to stand up, to go easy on the knees, you have them walk backwards, shuffle backwards if their knees are problematic, or they can grab hold of the swimming noodle to stand up. And following is a picture of my dad. This is what we instruct our patients to do after using the kinetic decompression tool. They can simply hang from a tree and eliminate their back pain. So after the kinetic decompression stretch, we teach our patients to hang from a pull-up bar. This is my dad at 85 years old doing a psoas muscle stretch with decompression. We're going to talk about psoas muscle in the following pages here, and we'll show the stretching of the psoas. I recommend this as a multi-time daily stretch to keep our patients back healthy for the rest of their lives. The caution in doing this stretch is for people with shoulder injuries and rotator cuff tear histories. Always, before teaching the patient, always inquire if they have a shoulder rotator cuff history or shoulder injuries like shoulder surgery, because it's not for everybody. The shoulders are the great caution on this stretch. So treat with caution the shoulders. Okay, and then we are going to begin our discussion on the psoas muscle. So, the psoas muscle implication in back pain. The only muscle we will be concerning ourselves with in the hang from a tree fountain of youth stretch is the psoas muscle. The psoas muscle is the strongest muscle in our body. Deeply located, it inserts at the 5 lumbar vertebrae of the lower back. It traverses anteriorly along the pelvic girdle where it attaches at the femur. The main function of the psoas muscle is to flex the hip. In other words, the psoas muscle attaches at the lower back at the 5 lumbar vertebrae, but runs deeply through the front side of the groin, deep in the front side of the groin and pelvis, and attaches to the thigh bone. The main job of the psoas muscle is to lift the leg up, to flex the leg, flex the hip. When we lift our leg up, flex the hip, the psoas muscle contracts. When we are standing upwards and straight at the hips, the psoas muscle is stretched and extended. In the sitting position, the hips are flexed and the psoas muscle is contracted. Prolonged sitting, whether at a desk, couch, or car in travel, is often a cause of back pain. Difficulty or stiffness in moving from the sitting to standing position is usually an implication of psoas muscle tightness or contraction. Now, I also think or have been taught that the psoas muscle is some of the strongest muscles in the body. So when we're sitting for a long time, they can remain contracted. And when we have a stiffness from sitting to standing, they may not be releasing themselves, which accounts for the difficulty, the stiffness and pain from the sitting to standing position. For psoas muscle, the psoas muscle and the iliopsoas, we're just grouping everything together, attaches at the 1st through 5th lumbar vertebrae. When standing upright, the psoas muscle is extended, like in this picture. When sitting, the psoas muscle is contracted, attaches to the femur to flex the hip. And then here's some pictures. The psoas muscle should always be suspected in back pain, and especially when a patient tells me they get pain or stiffness from the sitting to standing position. Okay, that's going to raise your psoas muscle flag alert. If the psoas muscle remains in a prolonged contracted state from too much sitting or flexion at the hip, it may have difficulty in relaxing or fully extending itself as we try to stand straight. Being the strongest muscle in the body, it may have more difficulty in relaxing itself from the contracted state. An indication of unrelenting contraction of the psoas muscle is forward flex position of a person at the hips. You will see this in people with back pain who walk with a hunched forward gait. So sitting down, psoas muscles contracted, This is the cobra position in yoga. We're extending the back, psoas muscles stretched, and this position is the psoas muscle stretch that we're going to do hanging from a pull-up bar. It's just the cobra position in an upright position, and then I'm going to show you how to do this lying on the edge of a table as well. So when you see people with a gait, they kind of have a forward hunch, um, leaning forward. Maybe they're favoring one side. The psoas muscle is contracted and not fully extended. So you can watch their gait and you can just see and suspect psoas muscle by this forward hunch. Why is the psoas muscle painful and difficult to extend during back pain? During lower back pain, the psoas muscle likely remains contracted to guard and protect the spine from further injury or movement of the disc. There may also be inflammation located at the site of a disc injury. Movement by the psoas muscle may trigger a painful inflammatory response. This occurs in the acute stage of disease, which may make doing these stretches difficult. In the chronic stage of lower back pain, when the inflammation has subsided, this stretch will be much better tolerated. So this is interesting because I think young people in their 20s, 30s, and this is Dr. John Sarno territory, taking on a lot of responsibilities, they get hit with the acute back pain, acute sciatica, or maybe it is their first history of a disc, bulging disc. So there's inflammation and sensitivity. So they can be some of the most difficult patients, these young people suffering this, but we're still going to teach them in the stretch. Now, in the chronic stages of lower back, the older people, they have a history of disc, and there's not so much inflammation there. And usually it's like they get good results. Like I think the older people, I give them in my Choi progression analysis, I give them a more favorable prognosis than I give some of these young people with these signs of like Dr. John Sarno, stress and acute bulging disc. The older people actually have a more favorable prognosis, in my opinion. They respond very well to this hanging back stretch. How to stretch the psoas muscle. The only way to stretch the psoas muscle is by extending the hips. To stretch the psoas muscle, you have to bring your feet behind you so that the angle of the hips is arched backwards. This counters the forward angle of the hips in the sitting position. There are many psoas muscle stretches that you find on the internet. For the purposes of the hang from a tree fountain of youth stretch, we will essentially be assuming the cobra position in yoga, which is the second picture above. The only difference is that instead of lying stomach to the ground, we will be hanging from a tree or a bar. And then here we go. So there's a starter position to go easy on the shoulders because the caution is the shoulders. Start with one leg behind you. So single leg behind, single hip is angled backwards. Therefore, you can rest a little bit on the opposite leg, and you're not putting the full weight of the stretch. Target is stretched on that picture, the top picture. My left side psoas muscle, left leg is back, right leg is front. It's supporting the weight, so I'm not fully supporting my weight on my shoulders. Now, when the patient feels comfortable with their grip, then they can bring both legs behind, both hips angled backwards, lightly on their feet. Now, their feet are touching the ground. You don't swing, just keep the toes on the ground, but you are fully supporting yourself on your arms, shoulders, and hands. So you have to make sure of confidence in the grip. Position one, full stretch, fully feet lightly touching the ground, mentally relaxing the muscles from the belly button down. Let the weight of gravity pull the lower back down. And that's what this is. It's a decompression stretch. We're letting the weight of gravity just pull and stretch the legs down. Now, this is the alternate hand grip, and this is not a psoas muscle, but this is still a good decompression stretch. So sometimes I think this grip is more comfortable on the shoulders. I'm not placing my hands both front forward. They're just holding one behind the other. This is an alternate hand grip. Um, both feet can be in position in front of you. You can do this with the psoas muscle stretch, but it's about the grip here. It's a little more comfortable on the shoulders. So some patients will like this better. And you could do this with the feet in front of you or the feet behind you. And then um, what I teach my patients that, especially if they're not able to do the hanging back stretch, you can lie at the edge of the massage table and you just let the legs dangle. You let the legs dangle off the table, and this is the opposite of sitting. Um, just let the legs dangle, and you'll see the opposite of sitting is stretching the psoas muscle stretch. So these are the psoas muscle stretches. We're going to play you some video of the kinetic decompression stretch, and then we'll do some psoas muscle stretches.
This is Dr. Evan Mahoney's kinetic decompression stretch for the lower back, or the kinetic hanging back stretch. We're just going to do a demonstration. This is a demonstration video to support the book Korean Kinetic Acupuncture Technique. This is done after all the back procedures have been finished, and usually the last thing we do for our lower back patients to finish the treatment. I'm going to take this noodle, place it under the arms, double wrap, triple wrap. The more times you wrap around the bar here, the more secure, the more able you'll be able to hold the patient up, and it's easier to hold the patient up the more times you wrap at the top. So when the noodle's in place, you're going to instruct the patient to just bend their knees, and then they're going to walk their feet forward, and they're going to just bend their knees, let the weight of gravity pull and stretch the lower back. Their feet will always be touching the ground. Try not to have them swing or rock. So go ahead and walk forward, and then bend your knees, and just let the weight of gravity pull and stretch the back. The caution is the shoulders. Ensure that the patient comfort with the shoulders is always comfortable, and hold for 10 seconds. If everything's okay, ask, can they feel the back stretch? They should be able to feel the back stretch, and their shoulders should be comfortable. And then 10 seconds passes, stand up, and then have the patient walk in place, lift their legs up as high as they can, ask how does their back feel, and give it a minute or two or a few seconds, and then you're going to repeat the exercise. So let's repeat one more time. Bend your knees, come forward. Bend your knees, let the weight of gravity pull and stretch the back. The patient's not swinging or rocking, and they just let the weight of gravity pull and stretch the back. The shoulders should be comfortable. If not, then instruct them to stand up immediately. Stand up. You were able to feel the back stretch?
Yes.
Okay, good. And walk in place. And then that's how we finish our back treatment. Hello, I'm Dr. Evan Mahoney, your acupuncture pain management specialist and creator of the Fountain of Youth Muscle Stretch series. Today we're going to demonstrate our famous hang from a tree, eliminate back pain stretch. This is a stretch for lower back pain, and for the psoas muscle it is a decompression stretch as well. To explain this stretch, we're going to demonstrate it on the example of the inversion table. Come this way. You may be familiar with the inversion table. You step in it, it's attached at the ankles, and it swings you upside down. It does two things. It separates the vertebrae, and it stretches the muscles of the back for pain relief. Well, we can accomplish the same thing as the inversion table with our hanging back stretch. I'm going to demonstrate two stretches. The first is going to be pretty straightforward, while the second I do need to explain a little bit. The second includes the psoas muscle stretch. Now, the psoas muscle is the strongest muscle in the body. The psoas muscle attaches at the 5 lumbar vertebrae here on the lower back. The job of the psoas muscle is to flex the hip like this. So, even though the psoas muscle attaches at the back, it runs very deep down the front of the groin to flex the hip like this. I'm going to use my biceps as an example. As I'm standing straight and upright, my psoas muscle is extended, but if my legs are flexed, my psoas muscle is contracted. Because the psoas muscle is the strongest muscle in the body, if we are in a sitting position, the psoas muscle is contracted, And a very common type of back pain is from the sitting to standing position. And in this case, the psoas muscle is contracted. It may not want to release itself from that position. So in order to stretch the psoas muscle, we have to do the opposite of this, which is this, angling and arching the hip in a backwards direction. So, you can film me. So on stretch number 2 that we're going to show you, we're going to incorporate a psoas muscle stretch using the hang from a tree, eliminate back pain stretch. We're going to demonstrate now. Okay. Before doing this stretch, we advise you to consult with your doctor. If you have a history of shoulder pain, discomfort, injury, then refrain from doing this stretch. If there is any pain in the shoulder or any part of the body doing this stretch, then just pull off and refrain from doing this stretch. So once again, consult with your doctor and avoid if you have any kind of shoulder injury, history of illness, discomfort. We're going to start with stretch number 1 first. I'm standing parallel with the bar. I grab it, I walk my feet in front, and then I just fall back. And I'm just letting the weight of gravity, pull and stretch my lower back to the ground. We're just using gravity to pull and stretch. This was stretch number 1. In my opinion, it's easier on the shoulders. So if there is shoulder discomfort, you may want to try stretch number 1. Stretch number 2, we're going to include the psoas muscle. So, as you can see, right now my left leg, my hip is being arched in a backwards direction. I'm letting the weight of gravity pull the back. I'm relaxing my stomach muscles, just letting the weight of gravity pull and stretch. You can do one leg at a time, you can switch legs, or you can do both legs at the same time, which is what I prefer doing. And you'll see you can do varying angles. Your feet do not have to be so far behind you. They can just be almost vertical underneath you. And this will provide a really good stretch for the lower back. You can read about this stretch in my book, Eliminate Back Pain, Hang from a Tree, available on Amazon.com. You can read my other books as well, Psalm Medical Meditation Series. I'm Dr. Evan Mahoney. This is part of the Fountain of Youth Muscle Stretch series. Thank you very much.
This concludes Movement with Needles, Korean Kinetic Acupuncture, featuring VST Acupuncture and Korean Kinetic Acupuncture. I hope you can get an appreciation for Haeyoim, whom we introduced at the very beginning of this video. Haeyoim from the 16th century Korea, where he inserted needles and had his practitioners stretch the fingers and wrist of his patients. He truly is the father of trigger point acupuncture, and then with his genealogy, I would definitely include Dr. Choi and Dr. Jonghwa Lee within this genealogy of trigger point acupuncture. And so I want to just express my appreciation for my teachers, Dr. Choi and Jonghwa Lee. If you have the chance to seek them out and get their guidance, they taught me everything. And then they gave me the latitude to improvise and create some other variations of their techniques. And I really appreciate the latitude that Dr. Choi in particular gave me. I worked very closely with him for my year and a half at Samra Acupuncture Clinic. I was with him every day, all the time, driving around town, meeting other clinics and other doctors, other practices. But he taught me very much, and he's the model that I want to model myself after as being a doctor. So he's a great teacher, and I hope you can seek out his books and seek him out. He's in Los Angeles at Dongguk University. And then likewise, everything I said with Dr. Hyung-Suk Choi is also for Dr. Jonghwa Lee, a very respected doctor and great teacher. So if you can seek him out, he's at Irvine, California, Bliss Acupuncture. So on the following, to follow and finish, the Choi progression analysis chart, which we introduced at the beginning, and we're going to finish here. So I hope this video can give you confidence in your prognosis and your ability to get results very quickly and give you the confidence and skill to make prognoses and deliver on your prognoses and do your best for your patients and get satisfying results as quickly as possible. And so I hope your reputation will be esteemed and your skills and confidence will be increased. Thank you very much for watching this video series. We really appreciate it. And good luck to you. God bless y'all.
Where I go, there'll be some action.